SMART-T S20 Early Correction of Facial Retrognatism Phased Treatment for the Whole Duration Comprehensive Treatment Plan.
Early correction of children with facial retrognatism malocclusion, involving diagnostic classification, prediction of jaw growth, and long-term protocols, has always been a challenge in orthodontic clinical practice. SMART-T collaborated with Professor Gang Shen's orthodontic team, summarized and analyzed a large amount of clinical data, with the evaluation of mandibular morphology, the research of the growth trend as the cornerstone, and the GS technology system as the support, have formed a comprehensive protocol of full-cycle, phased and remediable, early correction of malocclusion with facial retrognatism. 7 steps for the treatment plan of early correction of facial retrognatism. Step 1. Confirm that the patient is in the first age group, that is, 6 to 10 years old, according to the age of patients with malocclusion of facial retrognatism at the time of the first visit. They were divided into 4 age groups. The first age group is 6 to 10 years old and the second is 11 to 15 years old. The third age group is 16 to 20 years old. The fourth age group is 21 to 25 years old or older. Step 2. Initial determination of whether the jaw morphology is rectangular or triangular. That is, the lateral cephalometric radiographs were used to determine the mandibular morphology, whether the mandibular morphology was flat and horizontally rectangular or triangular. Whether the mandibular symphysis is shallow concavity or a deep concavity. Step 3. Basic determination of the diagnostic classification of malocclusion of facial retrognatism. That is, based on the facial features, alveolar structure, occlusal relationship and other clinical manifestations. Especially the evaluation of mandibular morphology. A preliminary diagnosis and classification is made. If the patient is dentoalveolar originated type, mandibular positioning originated type, maxillary skeletally originated type. Maxillary and mandibular skeletally originated malocclusion of facial retrognatism. The pattern of distribution of mandibular morphology in facial retrognatism is dentoalveolar originated and mandibular positioning originated. Mandibular body morphology is flat and horizontally rectangular. Maxillary skeletally originated mandibular body morphology is flat and horizontally rectangular. Maxillary and mandibular skeletally originated mandibular body morphology is triangular. Step 4. Dynamically predict the growth trend of the mandibular morphology and growth pattern. That is, according to a series of cephalometric radiographs. Basically determine the mandibular morphology and the level of its concavity. If the mandible is flat and horizontally rectangular, the poor growth of mandible is limited, and the prognosis is good. If the mandible is triangular, the poor growth of mandible can be developed and the prognosis is poor. The triangular mandible with mild concavity has a poor prognosis but growth is still limited. The triangular mandible with deep concavity has a poor prognosis and almost unlimited growth. And the medical indications for surgery are high. Step 5. Full cycle, phased and mainline overall planning. That is, on the basis of a clear classification of retrognatism, a general plan for early correction and follow-up treatment is formulated. It generally consists of 3 treatment phases. The first treatment phase mainly focuses on maxillary horizontal expansion during the mixed dentition period, and anterior cross-bite correction. If conditions permit, maxillary forwarding traction orthopedic treatment can be performed simultaneously. The second treatment phase is in the early and middle permanent dentition period. If necessary, additional maxillary horizontal expansion and maxillary forwarding traction orthopedic treatment can be added. And perform extraction or non-extraction to align teeth. The third treatment phase, in the retention tracking phase, if there is a tendency for growth relapse, additional remedial treatment for maxillary forwarding traction and teeth alignment. Step 6. Select the treatment method according to the retrognatism classification. That is, on the basis of a clear classification of facial retrognatism, selecting to apply jaw orthopedics, and extraction or non-extraction to align teeth, and specific treatments such as perioperative orthodontics. Step 7. Correct application of GS technologies and devices. SMART-T GS technology, in the orthopedic and orthodontic treatment of malocclusion with facial retrognathism, plays an important role. Horizontal expansion and forwarding traction can be applied using S11 and S16. Mandibular backward can be applied using S10. Teeth alignment can be applied using S12. Perioperative orthodontics can be applied using S18. SMART-T collaborated with Professor Gang Shen's orthodontic team. Use diagnostic classification, mandibular morphology analysis, mandibular growth pattern research and the application of GS technology as the scientific basis for early orthodontic treatment of malocclusion with facial retrognathism and its subsequent treatment. Providing a full cycle, phased and remedial treatment plan.